we here, the nurse practitioners and Dr. Kaysen, one of us is here 24/7 on the unit to round on all of the newborns and take care of them. So what that means in particular is that we are here on the unit itself, not just somewhere in the hospital or on call. We are dedicated to the unit for those 24 hours, 7 days a week, so that way a provider is always here to care for the newborns. We attend all deliveries here on the floor, whether they be vaginal or cesarean deliveries. We're there for all of the deliveries. That way, if by some chance the baby has an issue that arises after birth, we're there in seconds to treat the newborn and stabilize them, as opposed to coming from somewhere else and delaying care. We also round on all of the newborns daily here in the hospital, so we do their daily exams, monitor their weights, their intakes, make sure that they're feeding appropriately, answer any questions the parents may have, educate them on basic newborn care to give them the confidence that they need to go home and care for baby, as well as educating them on safe sleep practices and things like that until they can get home to see their pediatrician. So at deliveries that we attend, we are there with the nursery nurse at the bedside warmer for the babies. We basically just are there as a comfort measure, so that way if there's an issue during delivery that a baby has complications wise afterwards, needs just a little bit of help with breathing or stability and things like that, we're there to start treatment and make sure that baby does well transitioning from inside mom outside.
So one of the unique aspects of our labor and delivery unit here at St. Francis-Emory Healthcare is we provide 24/7 dedicated OB anesthesia services, meaning that you have an anesthesia provider on this unit 24 hours, 7 days a week that gives the opportunity to respond to emergencies with no delays. Also allows for us to provide labor epidural service with no delays. We also have secondary to labor epidural service. Obviously we have IV pain medication that can be provided, and we have nitrous as an adjunct to those IV and labor epidural services. One of the advantages of having 24/7 OB anesthesia coverage here is that we see all of our scheduled cesarean sections for preoperative evaluations the day before their scheduled procedure. That allows them to ask questions, allows Dad to be here to ask questions, and so forth.
So here at St. Francis, we have a nursery, but it's only utilized if parents request. Our goal is to keep baby with families for as much time as possible while they're here, so they get that bonding and feel secure enough to go home and care for the baby. Most babies here don't go into the nursery while they're here unless for some reason the families need them to come in, or if a baby has an issue that arises like temperature issues or becomes sick in some sort of way, we can then take them to the nursery. But otherwise, our babies spend most of the time in the room with the parents at the bedside. That includes all care that we do, for the most part, is done in the room with the parents to prevent any kind of separation. Only about 2.3% of our babies end up being transferred to the NICU somewhere else, so we pride ourselves in staying up to date on current guidelines for treatment and evidence-based practices to maintain babies here as much as we can. We are able to do things like phototherapy here in the room with the parents at the bedside, so that way baby doesn't have to leave to go to the nursery to get the phototherapy for jaundice concerns or be transferred out to get that care from somewhere else. We are also able to manage things like hypoglycemia in infants here by providing IV fluids for the duration of stabilizing the glucoses in the babies. We are able to do screening labs here on the babies and provide antibiotic coverage for extended lengths of time if the baby does in fact show signs of infection and needs prolonged antibiotic course. We can keep the babies here in the room. Even if mom is discharged and able to go home and baby is not ready, we work very hard to make sure that the parents are able to room in here with the baby, so that way still after discharge they're not separated either. and they still get that bonding time while baby is receiving the extended treatment. Some of the standards of care that we offer for the babies here at St. Francis for pretty much all of deliveries here is that we do delayed cord clamping on the babies once they're delivered, as long as they are stable and proving themselves to be okay. We do delayed cord clamping on all of them for a goal of at least 45 seconds to a minute, if not longer, if the parents desire. We've implemented delayed baths on the babies to keep that vernix and things like that on the baby as long as possible to help them transition. We offer the option, if parents choose to do the cord blood donation, which is a new service here that we're offering here that we're super excited about and parents seem to be thrilled about. We do have a lactation consultant here on staff, so they round on the mom daily while they're here. She also has a breastfeeding support group that she does every Tuesday from 2 to 3:30 here in the classroom on the unit, so that way once mom goes home, if they have any concerns with breastfeeding or just need that little extra support when they get home and don't have the staff here to ask questions, she can observe them and give them the confidence to know how breastfeeding is going and help if there's any issues that they may be